Hi, I'm Donna Cranston with Defenders of Freedom, and I'm here with Dr. Michelle Eisenmann from Resiliency Brain Health. This is our second week in for the month in for talking about brain injury awareness. So, welcome, Dr. Eisenmann.
Thanks for having me here, Donna.
She was in Puerto Rico last year or last week, so she didn't get to join us. So, we're glad that you're here today.
Yeah, a little bit of tan,
A little bit,
just
yes,
a little bit.
you did. So one of the things that we wanted to start off with was to follow up with a question that we had last week about the blood work and the chemistry do, why we incorporate that into what we're doing for the brain treatment.
Okay. Um, so blood work in chemistry is actually very important. And one of the things that we want to talk about and emphasize here is that if you have sustained a brain injury and you're not looking at your blood chemistry, that is something that you should be doing. One of the major reasons why you should be looking at it is because number one, hormone production, as you and I both know, begins in the brain. Different processes, physiological processes that we work with, and many other concussion TBI type um, places work with address the physical aspects of our body. But
Mhm.
our bodies are not just physical, they're also chemical. The very foundation of physiology involves the physical side and the chemical part of our body as well. So, different things such as hormone production in our brain as neurotransmitters in the rest of our body as well for digestion, such as insulin, as well for blood sugar regulation, inflammatory markers, and such are very important for us to be able to visualize so that the treatment plan can be effective.
Okay, great. And we do see that in a lot of the veterans that we put through. Many of them who are young have very, very low testosterone levels.
Yes.
Isn't that right? Yep.
Yeah.
So we've seen that, and it makes a big difference once they get that evened out.
And actually speaking about that, you talk about testosterone. Today is International Women's Day, so congratulations. Same thing happens for women, vice versa. So when we're talking about males, males tend to not always, but usually produce less testosterone, more estrogen, and females tend to flip and do a little bit of more testosterone, less estrogen.
Mhm. And that's exactly what we've seen
Yeah.
in the blood work. Okay, so we have actually, I just want to throw a shout out here to Jim Hirschner at Las Colinas Pharmacy because he is who we've partnered with in doing the chemistry side of the treatments that we do through Defenders of Freedom's program with Resiliency Brain Health. And Jim's been a huge piece on that and very knowledgeable and is all things wellness. And so it's been a really good fit for us.
Yeah.
So,
Gym is awesome.
yes. So today we're going to talk about the different severities of a brain injury. Can you let us know what those are?
Yes. So a lot of the time people forget that there are different severity types within a brain injury. So there is a mild, there's a moderate, and then there's a severe category. And so I'm going to go ahead and just elaborate on the second part here.
Okay.
Um, Mild, moderate, and severe are usually distinguished by time of loss of consciousness, penetrating head wound. So if there was an actual skull fracture, or if it's actually even a brain bleed without a skull fracture.
Okay.
Okay. And do you mind if I say one more thing?
No, not at all. You go.
For a mild, which I think you're really gonna like this part, you actually don't need to lose consciousness to get a mild traumatic brain injury,
Okay.
which is something that people don't realize. The word trauma involved, I think a lot of people perceive the moderate and severe, and they're like, yes, okay, that makes sense. Lost consciousness for 30 minutes or so, or, definitely had a penetrating head wound, brain bleed. People totally get that. But when it comes to mild, and an AKA for that is concussions, you don't need to lose consciousness at all.
Okay. So I always look at this from who I help, which is the veterans. And one of the things I tell them, even at like a concussive blast, where
Mhm.
they're not going to lose consciousness, that can also create a concussion or a mild brain injury, right?
Yes, and one of the things that to really talk about, and you've heard us say this to a lot of different patients, is the brain consistency and the brain stem consistency are very different. So the brain itself is a lot more sponge-like, in a way, more tofu-like, as what we usually say. Whereas the brainstem has a little bit of a harder consistency, and so that blast type injury that you're talking about can really create a sort of shearing effect within the brainstem and the brain itself. And so as you're getting these concussion blasts, you're getting that shearing effect and something called the Q counter Q reaction. So that means that the brain hits the skull, which is almost like cement, in the posterior aspect and in the anterior aspect as well.
Okay. So, obviously then we probably could say that, or you help me with this if we can or not, that a lot of people probably have brain injuries that have just been a mild,
Hmm.
even more so than the moderate or severe, because those are so obvious when people have them. But the mild, people can have a mild one and not even know, and have them repeatedly when we think about what our veterans or troops went through for a whole year. They could have had a lot of the mild ones that just kept stacking up.
Yes, and the word for that is a sequela. And the problem with that is because these injuries are so invisible, and you don't need loss of consciousness as well, you can easily fool yourself into thinking you didn't have a traumatic brain injury. Because again, the word trauma, people like to associate to bedridden or something disabled, where in actuality, a lot of the people that tend to have traumatic brain injuries, the mild kind, are very, very highly functioning individuals. Very, and you've seen that
Yes,
a lot.
yes, very
So,
much so.
what are some of the people that you would say, or what are some of the things that you look for in some of your guys?
Well, one of the things for sure is the repetitiveness of what they will tell me. They forget or might call me 3 days in a row to tell me the same thing, not remembering that they had even talked to me the day before. Um, that for sure. Ones that kind of feel badly that they went off on their kids over something that was very minor, but they had outbursts of anger or just constantly yelling or outbursting in traffic. Those are two very very common ones. And then probably another one is just lack of sleep. So many of them are not able to sleep, and will be up all night or just not able to sleep.
So, Donna is essentially a private investigator when it comes to localizing traumatic brain injuries for different people because she has so much experience with talking to people. She's actually a great person to talk to. So, if you are out there and you're wondering and you've been already previously in contact with Defenders of Freedom, she is a great person and liaison for that. But what would you say is another? So, one of the things that I want to get into before we're done for today
Okay.
is sometimes the whole aspect of the invisibility part
Hmm.
really messes with your mind.
Hmm.
You look in the mirror and you look so normal, but then you function in daily life and you're stumbling on yourself multiple times. So what would you say to someone that kind of feels like that right now?
I would say to understand that there's a reason why you're going through it. It's not normal for you. It's becoming your new normal, but it doesn't have to stay there. That we do have answers for you, that we can help, and to just give them a little hope, not to give up, not to become frustrated, but to reach out. I think that actually, I believe it's why we've seen so many suicides among the veteran community is because they don't understand why they're doing these things and can't get back to who they were or to just have the norm that they used to have before. And so as that starts slipping away slowly and this becomes their new norm, they don't like who it is. And what I've seen that you and Dr. Gaudet are doing at the clinic is amazingly restoring some of who they were, that they can start sleeping again, that the metronome that everybody hates why they're doing it because it's so frustrating for them, it slows their thinking down, it slows those impulses down and gives them that half second to just reset and realize, okay, yeah, this isn't worth getting so upset over. So those are just a couple just real basic things, but they make such a big difference.
Yeah, they do. And I think the biggest point that you talked about is the whole suicide part about it too, is because these mild traumatic brain injuries don't resemble the moderate and severe categories sometimes, this lack of functioning in your daily life can really drive you to points of desperation.
Hmm.
And so now we've entered on the mental. So we talked a little bit at the beginning about how important the chemistry is, the blood chemistry is for the brain, the physical parts, which I think are the most recognizable ones that people say, yeah, I definitely need help with balance or something like that. And then lastly, that mental category that is very, very important.
And one of the things that I've noticed over time is how many have the same symptoms and they think they're alone, that nobody else is acting like this, nobody has this going on, when in truth, probably more of them all have it going on, and they're just afraid to talk about it, or they're afraid to let somebody know. And I think one of our biggest successes is just me validating them. It's
Yeah.
like, no, you're not alone in this. It is what's common for what you're going, with a brain injury, what you're going through. And that just seems to almost be a relief for people that, okay, I'm not crazy, I'm not the only one. And that's one of the reasons I ask a lot of questions. I know those things that are so common that I can just start asking them, "Are you doing this? Are you doing this? Are you doing this?" And then, yeah, they realize that, okay, there is some hope.
Okay.
So,
Well, that's really great. I think we're almost at time. So I was
okay.
going to do a quick run through of the things that we've already talked about and see if we have anything else to add at the last part. Um, we talked about blood chemistry. We talked about the different severity types, mild, moderate, and severe. We talked about, oh, why do I keep getting told I don't have a concussion?
Mhm.
So, did we touch base on that?
No, we didn't. I thought you were going to
Okay.
leave it out.
Oh, okay. So we still have time. But basically, one of the things we wanted to discuss is why people getting told that they don't have a concussion. And I think the number one reason that honestly keeps happening is because some practitioners don't have maybe the level of understanding of the fact that you don't need to lose consciousness after getting a head injury. And also because you may be a very highly functioning individual. Again, you may be able to drive, you may be able to take care of a family, you may be a caregiver yourself, but because your level of functioning is not subclinical, I mean, it's still subclinical, it's not in a clinical form that you are, necessitating help all the time. I think that's another reason people keep getting told that they don't have a concussion. You don't have something debilitating you. So we're really skipping. And if you haven't noticed yet, we keep talking about mild traumatic brain injuries. It's because that's the child that keeps getting forgotten in the traumatic brain injury world. Because we want to skip to the moderate and severe so much, and then we just forget or assume that concussions heal themselves, which can be true for some people. I'm glad for you if that is, but not for everyone.
Mhm.
So,
Especially when they layer, when you
mhm.
keep having them, right? And nothing, the inflammation hasn't gone down, then you get another one. So then it compounds.
Yeah, and that can be a lot.
Mhm.
So,
Well, thank you. It's very informative. If you're out there and you're struggling with a brain injury, please reach out at defendersoffreedom.us or resiliencyBH.com, and we would be more than glad to talk with you and see if you would be a good candidate for treatment.
yeah, thank you for listening in, and we will talk again next week. I got this. I thought I got this one.
Yeah.
Ah, I think Jody's got this one.